Welcome back. It's a phrase that most of us have probably heard at one time or another. You look tired. Of course, it's not the most flattering thing to hear, but there may be more behind it than just how much rest you're getting, and there are some different ways that you could try to freshen up the look around your eyes. And here to tell us about what we are calling eye to eye on aesthetic health, we welcome Dr. Amit Patel, a UK facial, plastic, and reconstructive surgery specialist. And he's got a lot of different things that you talk to patients about when they come in and complain about sort of that look around their eyes that may be tired or a little bit aging. And what advice do you have for folks?
Well, like you said, it's not uncommon for patients to come in and, for a cosmetic consultation, and their biggest complaint is, hey, you know what, I look tired, or that statement that you just said where someone walks up and says, you know what, you look tired, are you feeling okay, and they've gotten a full night's rest. and it makes perfect sense whenever I almost consistently, when we put a mirror in front of the patient and we kind of look, say, what's your problem here, it's usually around the eye, and it makes perfect sense. We communicate with our eyes all the time. But one of the first things that I usually talk to patients about is just their lifestyle. If you look tired, then there might be a reason why you may be tired. And so getting enough sleep, obvious, but then drinking enough water. A lot of our face and our volume of our face makes a big, important component of what we consider aesthetically pleasing eye structures, and so I recommend at least 8 glasses of water a day, and then making sure around this part of the country allergies are under control, making sure that really adds that puffy look to the eye, and it's not really something that we consider attractive, and so making sure that's under control as well. And then finally, there's always those little slips of anatomical changes that happen that Mother Nature kind of slips in there right as we're kind of never expecting them, and so I go over an illustration with them to just kind of explain where changes occur, because it is an individual to individual difference.
And we have a look at that graphic to sort of see, we won't call it really the before and the after, I guess, but it really is sort of the changes that you mentioned that we all tend to go through.
Yeah, my patients really don't like it when I put this up. It kind of is that stark mirror, but this is a really nice illustration from a medical textbook, cosmetic surgery textbook, and on the left you have this picture of a kind of youthful face compared to a more aged face. And one of the big things that I really stress to my patients is your aging is a function of an individual problem. Everybody is different, but I kind of break it down into components. As you can see, there are several different layers here. And one of the most important things that we commonly forget about is just the wrinkles. We use our eyes for expression, and that's why we very frequently feel like we're worried about our eyes. And relaxing these muscles, these commonly known terms as crow's feet, that kind of furrow between the eyebrows, you can relax those with items such as Botox or Dysport, and that's usually an in-office procedure. And then when you kind of look back also at the left side of that face, which is youthful, and the right side, you can see there's a big difference in volume. If you run your finger right along the bottom part of your eyelid, between your cheek and your eyelid, you can see that there's bone supporting one part but not the other part. And in the youthful eye, you can see there's no real transition, and that's where we commonly come up with that term dark circle. And so filling that area in with a filler or fat really can kind of help things out. And those are, again, a non-surgical procedure. And finally, that sometimes we'll have extra eyelid skin, and that usually requires a very small procedure. But the important thing is just realizing that everything from your lifestyle, drinking enough water, all the way up to volume and wrinkling can be sometimes addressed without surgery, and then you do have surgery as a final option. But I think it's very important, especially around this part of the country, to get those allergies under control too.
Who knew? A lot of people may not have even thought of that as factoring that, the look around the eyes. Well, thank you so much, Dr. Patel, for being with us.
Well, thank you.
You see the phone number there for the UK Department of Plastic and Reconstructive Surgery if you would like more information and a consultation. We'll be right back with a check of a stormy forecast.